Dude, man, you look like a banana. What the hell? What I'm talking about is penile curvature. This might be an uncomfortable topic for some people, but it's an important thing to know about. Penile curvature can be anything from just a couple degrees to something extremely severe, almost like a 90 or even 180 degree bend in the penile shaft. This usually signifies some previous trauma. Yes, it is possible to fracture or break the penis. The penis, if you think about it, is basically like sausage in a tube, and when that casing of the sausage breaks, it creates inflammation and scar tissue, just like any other tissue in the body. It's a normal part of the healing process, but unfortunately this can create a variety of cascading effects that oftentimes men will choose to ignore because of embarrassment or fear or worry or a variety of other factors. It's something that I encounter in my practice on an almost daily basis. And I think a little bit of education and information is just the key take-home point here. Oftentimes, the initial inciting event is some microtrauma to the penis, like a forceful event, a kick or blow during a sporting event, a bicycle crash, insertion during a portion where the penis is not fully rigid, and it actually causes the penis to abruptly bend and damage some of the casing, if you will, or the fibrous connective tissue in the various erectile tubes of the penis, and this can result in scarring and subsequent development of curvature, which can progress over time, and this can be a significant contributing factor to erectile dysfunction. So to ignore that and just to hope it goes away or hope it doesn't progress is really to ignore the bigger picture, because once the cat is all the way out of the bag, so to speak, it becomes much more difficult to put it back in, if you will. And there fortunately are various treatments that can help with this. There's plenty of literature and data on that, whether it's ultrasound therapy, whether it's a sort of traction or stretching device. The literature is fairly robust in that regard. There are newer injection therapies which sound horrific to most men, but the reality is that the portion of the penile shaft where these substances are injected is much less sensitive than the tip or glands of the penis, and so it can be highly effective, particularly when utilized in combination with a skilled practitioner. I've had patients that have had pretty significant penile curvature that have underwent ultrasound or shockwave therapy, if you will, done by a trained expert. This is painless, followed by some utilization of traction, followed by some injection therapy by a urologist with, fortunately, some pretty impressive resolution and correction of the penile curvature and improved sexual function overall. So obviously you can throw pills at this. You can take Viagra, Cialis, Levitra, Stendra, use the Muse therapy. There's a variety of options, but unfortunately I've had a number of patients who have ignored this over many, many decades and subsequently had significant additional trauma to the penis where there was really no solution or no intervention to allow return of sexual function other than a penile implant. And fortunately, these procedures have become much more commonplace. If this is something that you're contemplating, I would recommend finding a urologic surgeon who is certified in sexual health and who does at least 50 of these procedures a year, if not more. There is risk of infection, risk of removal, and need for reimplantation. I've had several patients that have undergone several of these. I've had one patient that underwent 3 of these with some still regaining of sexual function, but not ideal situation by any stretch of the means to undergo 3 penile surgeries, because obviously any surgery in the body will generate scar tissue and inflammation as part of the normal healing process, which can aggravate erectile dysfunction. So if you're somebody out there who's suffering from a banana-shaped penis, I encourage you to consult a local urologist sooner than later. That's it. Be safe, be well, have a great week. Share this if you found it valuable.